Good afternoon, and thank you for joining us. Today, we're going to recap some of the discussion and actions of the Board of Supervisors that we've taken over the last couple of days, and then we'll go straight to the questions. Supervisor Fletcher had a scheduling conflict today and cannot be with us, but he will be with us next Wednesday for the briefing. We're going to be joined today by Dr. Wilma Wooten, our Public Health Officer. Over the last several days, the Board of Supervisors have been meeting to weigh its options regarding the state's placement of the county on its reopening tiers. As you know by now, the state announced yesterday that we would remain in the red tier, which allows for limited indoor operations at most businesses. This is good news, as we avoided being placed on the more restrictive purple tier. But the reality is, we remain at risk of being moved to that more restrictive tier in the future if we don't continue to do those things that we know that we need to do. We are working with the state to share our concerns and thoughts about the metrics that they are using to place our county in the different tiers. Yesterday, our board voted to support Dr. Wilma Wooten in her continued dialogue with the state on the adjudication process to work out differences we have on data and metrics being used so that they reflect the dynamics of the pandemic here in San Diego County. Dr. Wooten and our public health staff are fighting tooth and nail to make sure the state takes several factors into consideration, and we certainly support her in that effort. But I can't stress enough that this is just one part of the solution. The rest truly is up to you. If we want to avoid sliding backwards into a more restrictive tier, it's really going to depend on following the safety measures we've been talking about for all these last few months. We all know them by now, probably by heart, and they're pretty basic. Again, it's covering your face when you're around others. It's avoiding large gatherings. It's maintaining your distance, and it's washing your hands regularly. This pandemic is not going to go away just because we want it to. We need to make it go away. With that, I'm going to move over and ask our Public Health Director, Dr. Wilma Wooten, to come forward and give us the latest update for today.
Thank you, Supervisor Cox, and thank you everyone for being here today. As of today, there are approximately 32 million confirmed cases worldwide of COVID-19, and almost 7 million in the United States, which includes over 200,000 deaths. And that's a significant milestone that I'm sure you've heard about on the news over the past several days. Today's local case count for San Diego County is 45,425 cases, which is 278 more cases than yesterday, an increase in new cases since yesterday's report of 222 cases. This overall total number of cases includes 767 deaths, which is 2 new deaths reported since yesterday. The age range for San Diego's total cases is the same, 3 months to 102 years of age. The age group from 20 to 49 years of age still encompasses the majority of the overall cases at 58%, or 26,229 cases. 51% of our total cases are female and 49% are male. And 3,450, or 8% of the cases, have been hospitalized, and this number includes 813 that have been admitted to the ICU, which is 2% of the total number of cases and 24% of those individuals that have been hospitalized. The total number of cases also includes the 767 deaths that has increased by 2 new deaths today. So next, I'd like to review COVID-19 demographics related to hospitalizations. The majority of the 3,450 total hospitalizations, which is the majority is 2,469, or 72% of the hospitalized cases are among individuals that are 50 years of age and older. Males represent the majority of those hospitalized at 54%. Hispanics and Latinos represent the majority at 62%. In the next slide, it speaks to further information on the demographics related to deaths. 43.5% of those who have unfortunately died are female, and 56.5% were male. 732 or 95% of the total number of cases had underlying medical conditions, and 35 or 6% did not have underlying medical conditions. And as always, we extend our sincere condolences and sympathies to those individuals, families, and friends that have lost a loved one due to COVID-19. And also, all of the statistics that we share today and additional information is found on our county's website, www.coronavirus-sd.com. Now, let's move to our triggers dashboard. And the only item that's abnormal, the only metric is community outbreaks, and as you can see, that number is decreasing. Today, we are reporting 13 total community outbreaks for the past 7 days from September 16th through September 22nd, which represents 73 cases. Also today, no new community outbreaks were reported. Now, in the next slide, under the blueprint for a safer economy, next slide, yes. The tier framework lays out the metrics and thresholds that each county must meet in order to open more sectors and parts of the economy, and shows tiers based on the risk of the community disease transmission. So the highest or most restrictive tier is purple, where you will see widespread transmission. The second is the red tier, or tier 2, where you see substantial transmission, and that's where San Diego currently resides. The third tier is level 3, moderate transmission, and then the fourth tier is minimal transmission. Now, in the next slide, I just stated that San Diego is still and remains is in the red tier. So certainly this is great news for our region, and we must continue at a minimal to maintain this red tier status, or even improve our status to a less restrictive tier. In the next slide, the metrics framework includes case rate and testing positivity. But equally important is the state's testing rate. The state's testing rate per 100,000 population has previously been reported as an overall average and would change from week to week. Last week, the state changed this metric from an average to a median testing rate and allowed it to be in use for 4 weeks. So we have 2 additional weeks where the state's median testing rate will be 216.3. Now, this testing rate is used to calculate the adjusted case rate, and it adjusts it down if a county has a median testing positivity, or a testing rate that is above the state's. And if the county has a testing rate that is below the state, then that adjusts the case rate upward. And that's a direction that we do not want to go in. So I will be talking in a few minutes about our testing efforts. Now, for the period from September 6th to September 12th, San Diego County has had an unadjusted case rate of 6.8 and the adjusted case rate of 6.9. And because our testing rate was slightly below the state's median rate. But I will be talking about our testing efforts, and we hope to increase our testing activities. The testing positivity continues to be in the orange tier or tier 3 and has decreased to 3.8%. As a reminder, this means that in the next slide, indoor activities that recently reopened can continue. And as you can see on this slide, on the left of the slide, the purple tier, it shows the activities that those counties who are in the purple tier can have open. And all other counties or all other counties in the other tiers, they can have those businesses open plus the businesses that are cited for their specific tier level. So for San Diego County, all of the activities that are on the left can be open plus those businesses at the percentage of operations identified that's on the right of the slide. One new a factor that changed yesterday from the state was they moved nail salons over from the purple tier, rather from the red tier to the purple tier. So that is a new activity that is now allowed for the purple tier, and San Diego being in the red tier can enjoy those purple tier activities plus those activities that are identified for the red tier. So now, even though we are still in tier 2 or the red tier, the county could drop to the purple tier if the state case rate goes, or if the local case rate goes above 7, and not 7, but above 7, so 7.1 or higher per 100,000 residents for 2 consecutive weeks. It would take 3 weeks for the county to be able to move to tier 3 or the orange tier, but not before driving its case rate down below 3.9 cases per 100,000 population for 14 days. The California Department of Public Health will assess counties on a weekly basis, and the next report is scheduled for next Tuesday, September 29th. And information about the tiered system, the state's tiered system, can be found on the state's website at covid19.ca.gov. Also, on the next slide, as it relates to testing, I wanted to announce today the county has reached a significant testing milestone and has accomplished over 1 million tests. And I would like to acknowledge a great thank you to all of our community partners, our hospitals and community clinics that are conducting testing, our pharmacies that are conducting testing, and our partners, our schools, as well as our county team that has done a tremendous effort to get us to this point. If you will see on our T3 strategy slide here, we have a 7-day average of daily tests at 8,241, and this is from September 16th to September 22nd. And also, as it relates to tracing, we've maintained our target of over 90% for case investigations as well as contact tracing. And as it relates to our treat strategies, particularly housing individuals that need a safe place to either isolate or quarantine, our 7-day average of individuals in our public health rooms is 66. Now, in our next slide, I just want to emphasize that we will continue to be vigilant to operationalize our priority testing framework, to test those who are symptomatic, which are tiers 1 and 2, those that are asymptomatic groups or individuals in tiers 3 and 4, and our public health surveillance, which is tier 5. Our goal is to test the right people that need to be tested in San Diego County, and that pool is large enough to ensure that we maintain ourselves over the state's median testing threshold. Now, as everyone should be aware, we are coming up on flu season, and influenza is highly contagious and can spread quickly in our community. Every year, thousands of individuals in the U.S. are hospitalized due to illnesses related to influenza, or what we commonly refer to as the flu. Last flu season in San Diego County, we had 20,711 cases of influenza and 108 influenza-related deaths. The same strategies to prevent COVID-19 are also helpful for flu prevention. However, one big difference between COVID-19 and the flu is that we do not have a vaccine for COVID-19, but we do have a vaccine for the flu. Make sure that during this flu season you do everything that you can to protect yourself, your family, and your friends and those around you by getting a flu vaccination. Getting the flu vaccine is the most important step in protecting against the flu. So in closing, we want to close with these strategies that we share with you every time we have the opportunity to do so. With your help, we have been able to maintain ourselves in Tier 2 or the red tier. And I want to give a big shout out and thank you to all San Diegans, businesses, our sectors, and community partners. We can only accelerate to the next less restrictive tier, which is Tier 3 or the orange tier, if we continue to stay the course and follow these simple strategies: washing your hands and promoting sanitation practices, staying 6 feet apart from others if they are not in your household, wearing a facial covering, avoiding crowds, and importantly, stay home if you're sick. Now I'd like to turn the podium back over to Chairman Cox. Thank you.
Thank you, Dr. Wooten. Unfortunately, our phone system had a bit of a glitch, and so we will not have any phone-in questions today. Those people that were trying to call in, we urge you to go ahead and text your questions, and we'll go ahead and have those read and responded to this afternoon. This first question, I think, is going to be dealing with testing for children, and Nick Mascione, the director of our Health and Human Services Agency, and the testing, tracing, and treatment czar, is going to respond to that.
And this question is from Shannon Handy with CBS 8. Is the county making plans to make COVID tests more accessible for children? With the County Office of Education's new policy in place and more children returning to school, it's safe to assume there will be an influx of kids who will need to get tested.
Thank you for that question, Shannon. As you know, the state, as part of the guidance for school reopenings, has made it a strong recommendation guidance for school personnel, teachers and custodians and folks that work in schools. And we are working indeed with the County Board of Education for the 80,000 school personnel in our public and private and charter schools. And we're expanding our testing sites. But we have 600,000 school-age children. And as Dr. Wooten talked about with the flu season coming up, we know some kids may indeed be exposed to the virus. And so whether a parent wants to make sure their child is safe, we start always by making sure they're working with their pediatrician for their child. That said, we are expanding. The state's making it clear we got to keep kids safe. And so we're expanding our testing for children. We started that months ago with Rady Children's Hospital with the COVID Collaborative for Children. And if you call 211, they can give you access to that information. If you're a Kaiser Permanente patient, you got to get back to your Kaiser doctor. But in addition to the COVID Collaborative and the Rady Network, we are also now working on expanding our county and our state testing sites. We'll be rolling that out shortly so that we can actually test children above the age of 6 months. So this is not only school-age kids, but kids in preschool that need to get that test. Thank you.
This next question actually has two parts. The first one is dealing with people wearing face masks, and we'll go ahead and ask the question to be read.
And this one is from Mimi Alcala with Channel 10, ABC. No matter how many times you urge the public to wear a mask and avoid large gatherings, there are some people who will continue to refuse to do so. Is there a different or new plan to get more people on board with wearing a mask?
Well, I mean, that is the key to this whole pandemic, I think, is encouraging people to continue to encourage people to wear facial coverings, to wash their hands, to maintain social distancing, to not gather in large groups. By and large, most of the public, I think, is doing a pretty decent job. I can tell you that the businesses, the restaurants, the folks that have been allowed to reorder have been some of the best enforcers we could have out there, because they know that their ability to stay in business is predicated on making sure that we stop the spread of this virus. So, I mean, I guess it's a request to the public to make sure that they do their part by wearing those facial coverings when they go out, when they're in contact with other people. And, you know, sometimes a polite word to remind people. I know sometimes I've gone to the gas station and got out of my car and didn't realize I didn't have my mask on, and I had to go back. Sometimes even the cashier wouldn't let me in because I didn't have a mask. So I know it's something that's easy to forget, but sometimes just a gentle reminder will help. But by and large, we've been pleased with the response of the businesses to make sure that people coming into their stores and their restaurants are properly covered with the facial covering. And we encourage everybody to do that, because that is the one thing that we can all do that will truly make a difference in the spread of this virus. I know the second part of this question deals with the metrics and the adjudication process, and Dr. Wooten will come up as that question is being asked.
And this question is, can Dr. Wooten talk about what she would like to see the state improve with the current metric system?
Thank you for that question. I'd just like to start by saying having the metrics of case rates and testing positivity actually have been our metrics all along, in addition to about 4 other metrics that were focused on hospitalizations and hospital capacity. The calculation of the current case rate is, however, different, and there is an adjustment factor. There are 3 things that, and I expressed this at the board meeting yesterday, and there are 3 things that we feel, and not just myself as the health officer for San Diego County, but other health officers across the state, utilizing, if counties are maintaining that hospitalization and hospital capacity, to somehow get credit for that, and also to get credit for contact tracing. We actually, I think something related to contact tracing is going to be coming down the pike from the state in the future. And also access of testing in vulnerable populations. San Diego has done an excellent job to date of getting access to testing in those communities that are hit the hardest or that are impacted the hardest. So those are 3 additional focus areas that we feel that counties should get credit for if they are doing a good job in those areas.
Dr. Wooten, this next question is also related to the tiers. This one is from Jared Aarons with ABC 10 News. San Diego was able to stay in the red tier, but our metrics still appear to be trending up. Meanwhile, we've been seeing other counties, for example, Orange County in particular, who are close to moving to less restrictive tiers. What are those counties doing to improve their numbers that we can emulate? Have any local leaders reached out to other counties for advice on how to get numbers moving towards a less restrictive tier?
If I could ask staff to bring up the map. Orange County just moved into the red tier. Remember from the beginning of the rollout of this tier system, San Diego was red, immersed in a sea of purple. So now we have 2 other counties around us that border us, Riverside and Orange County. They are doing the same things that we are doing here locally, focusing on those non-pharmaceutical strategies that I ended up with today and that I share with the public at each of these press conferences and at each board meeting. Until we get a vaccine, and nobody else has a vaccine right now, so until the U.S. has a vaccine that can be distributed and herd immunity can be achieved, our greatest tools are those things that I shared with you earlier, and if you can pull those up again. And this is what we have at this point in time. So this is what every county in the state of California and in every state across the nation, these are the tools that we have.
Dr. Witten, this next question is from Paul Sasson with the Union Tribune. 15 days have now passed since Labor Day without a significant surge in positive cases locally, hospitalizations or death as well. Does that mean we're not likely to see a Labor Day surge, or is it still too early to tell?
If there's going to be a significant surge, there's still the opportunity to see some impact, but I think most of the impact associated with Labor Day. Labor Day was the 7th, 14 days after is the 21st. That 14-day period is the incubation period. Now, certainly as you go progress through that incubation period, if you are exposed during the latter part of the 14-day period, then you can see cases, and that could still happen. So it's very possible we could still see some cases, but the greatest impact, I think, we have seen to date.
Thank you. This next question is from Mike McKinnon with KUSI. Do you think it would be safe for San Diegans to attend Padres games if tickets were limited, since the stadium is outside like the NFL allows in other states?
Well, a Padre game is a gathering, and with games, it includes and is associated with alcohol consumption, and when you mix those two, people, you lose their ability to operate and use their best judgment. It is a gathering. So currently, the state does not recommend gatherings. The state has issued guidelines on professional sports, and as you know, many of the sports teams perform, but there is no crowd. So again, I support the guidance that has been issued in that regard.
Okay, and there is another question directed to you, Dr. Wooten, this one from Derek Stahl, and he has two questions, so I'll read one at a time. He is with ABC 10 News as well. I know the county has previously explained why it does not identify outbreak locations. Can you please explain why the county cannot be more specific about the types of locations where outbreaks occur? For example, the county lists outbreaks at a medical facility, but many of our viewers would like to know if it's a dentist, for example, or an optometry office. This level of information seems unlikely to reveal exact locations.
We release information to the public regarding outbreaks if there are actions that the public can take. And obviously, with the large outbreak at San Diego State, that information was disseminated to the public because there is actions that students can take, that the community that the students reside in can take. When there are a couple of cases in any given location, and if we can identify all of those individuals that are exposed, there is no need to release that information to the general public. And that's how we have operated in public health well before the COVID-19 pandemic occurred. So that is our practice. Thank you.
And then Dr. Wooten, he had a follow-up question as well, so let me pull that up here. I'm sorry, there has been a few questions from him. Is the outbreak trigger a useful metric? I know the state does not use this metric, and it was created early on in the pandemic. Have there been any discussions about changing the definition of an outbreak, since it seems 3 cases is a low threshold?
Oh, the definition for an outbreak is not made by San Diego State. That is a definition that we get from the state, and also the Council on State and Territorial Epidemiologists, which is a nationwide organization, also weighs in on that. So that is a definition that we will continue to use.
Thank you, Dr. Wooten.
Thank you.
This next question deals with San Diego State University and the outbreaks that we've had there, and Dr. McDonald is going to respond to that question.
Okay, so this is a two-part question from Brandon Lewis with CBS 8. Supervisor Diane Jacobs said yesterday, young people, especially college students who are partying, are partially responsible for the COVID cases, but it did not appear to reflect that in the outbreak slide today. Have county tracers found young people partying are spreading the virus, or are they contracting COVID-19 elsewhere, such as more traditional community spread?
Well, let me try to address that in a couple of ways. we did not specify the actual number of San Diego State students that were part of today's numbers, so I can just specify that as of today, 19 of the cases that were included in today's total were San Diego State students. So that means that the total number of confirmed cases they have there is 893. There are also an additional 40 probable cases that we've associated with that outbreak, or set of outbreaks. We do know that the cases that are associated with San Diego State are, in fact, primarily related to social activities that are both on campus and off campus. And this particular age group has been involved with these types of social activities really across the county, whether it's in San Diego State for this specific outbreak or previous episodes during the summer in other parts of the county, for example. I think that really, rather than zeroing in on a specific age group, I think we should be talking about the behavior. And the behavior is not to have house parties and social gatherings that really allow the virus to spread. And that's the lesson that all San Diegans should be taking from the cases that have occurred at San Diego State University. That is, that really, even if you're having what seems like a quote, innocent or mild dinner party at your house with only 10 or 12 people, and they're all adults, if they are in fact not doing the things that we've asked, which is social distancing and wearing their masks and maintaining that type of hand washing discipline, on top of the fact that we've had in our health officer orders really since the beginning that these types of gatherings are in fact not allowed under the health officer order and in fact are demonstrably shown to contribute to spread. We just need to take that lesson from the cases at San Diego State.
And then Dr. McDonald, Brendan had a follow-up question. Can you confirm COVID-19 is the 7th leading cause of death in the county?
It is a different statistical section than my branch that actually has compiled those statistics. I believe that is correct, but I will get back to you to verify that.
And then there is another question related to universities from Jack Mulmut from Channel 8 News. There are a small number of cases regarding on-campus populations of students living at CSU San Marcos and USD. Is the county working with these schools to provide reporting and contact tracing, and are these student cases contributing to the overall case count in the county?
There's a couple of great questions there. It gives us an opportunity to say that actually throughout this pandemic period, as the county has been working with different sectors in the community, we've actually specifically worked with institutes of higher learning, colleges and universities with weekly meetings together. And in fact, we've had separate meetings with universities to talk about their specific plans. So each of the universities that you mentioned, Cal State San Marcos, USD, Point Loma Nazarene, and really all of the institutes of higher learning, we are having regular conversations with. When a specific case comes up, we actually work with the university, its student health services, and their planners who are involved with their reopening plans to immediately work to institute the public health precautions of isolation, quarantine, contact tracing. We've done that to a huge extent, obviously, at San Diego State, but smaller extents at all the universities that you've mentioned. And I'm being handed the actual sheet that shows that 1, 2, 3, 4, 5, it looks like it's number 6. The 6th leading cause of death currently this year in San Diego County is in fact COVID-19. It's just now edging out chronic lower respiratory disease, or which would include things like COPD. So that's really quite concerning. It's actually rapidly rising on accidents, and I would not be surprised if it comes into the top 4 by the end of the year.
And Dr. McDonald, one last question from Lindsay Winkley, and actually several reporters have asked this. She's with the Union Tribune. How many positive cases have stemmed from UCSD since students started to return to campus?
We are in daily contact with our colleagues at UCSD. They've conducted over 2,000 tests so far. They have another 20,000 tests to go, and I can tell you that they have not had an outbreak. So you should be able to do the math to figure out what that means.
Thank you, Dr. McDonald.
Well, that completes our questions for today. And again, we apologize for the glitch we had with our phone system, but we appreciate everybody shifting over very quickly to the texted questions. As was mentioned by Dr. Wooten, today is a milestone for the county. Over 1 million tests have been conducted in the San Diego County region. And that's an incredible number, and it certainly is a testament and really a recognition of the hard work on the part of our many community partners, our testing teams, the contact tracers, and the Health and Human Services Agency staff that's been working so diligently, along with our medical professionals, to get as many tests as we possibly can get done. And it doesn't mean that we're satisfied, far from it. We want to do a lot more testing, and I guarantee you we will be doing a lot more testing. Also, I wanted to remind everyone that while we are still dealing with the pandemic, as Dr. Wooten had also mentioned, we are getting into flu season. We want to avoid overloading certainly our hospitals with the flu and pandemic cases, and this year it's going to be even more important than ever that people get their flu shots. And we urge people to contact their medical provider and schedule a time sooner rather than later to get your flu shot. If you don't have a medical provider, just please call 211, or even better yet, visit their website at 211sandiego.org/flu to get more information on free flu shots available throughout the region. Well, that's it for today. We'll be back again next Wednesday at 2:30. Until then, please stay safe, San Diego, and remember, wear your facial covering. Thank you.